Well, hello, everybody. I'm Norm DeVay. I'm with Copa Health, and tonight we are having a webinar, Navigating the Mental Health System, how to know who to reach out to and where to get help. It's not an easy thing. It's not an easy thing whether you have a mental health issue or not. I know that it's difficult sometimes to find good care out there. So we've got some people on tonight who just have a lot of expertise, a lot of people who have navigated through the system, and quite a few of them have done great work with advocacy too. So sometimes they are the ones that are making the change to the system to making it better. I just want to remind everybody before we get started that we do have two more webinars this month. We are doing them every Wednesday in May. So we will have another one on the 21st and another one on the 28th. And they are just so important. One of them about caring for the caregiver is just always just heart wrenching when you learn about some of the mental anguish that people go through when they're taking care of somebody. So if you do have interest in registering for those two, go to copahealth.org/resources, and you'll be able to register for those webinars. Or if you just go to the copahealth.org page, you should be able to click and get to the resources page. But let's get started. So we're going to start out with Josh Moselle, and Josh is with ACME, or I know he's done work with ACME, and he's an attorney and mental health advocate doing great things here in the state of Arizona. Josh, how are you doing today?
Good, Norm. Very good. Thanks for having us. I'm excited to be a part of this.
I am glad that you are here, Josh. It's always wonderful to get your, point of view on things. Next, we've got Kathy Bashor. Kathy is a real good friend of Copa Health. She's with the Arizona Family and Peer Coalition. I know I just butchered that because it wasn't written
You
down correctly,
always
Kathy.
do.
Yeah, so why don't you go ahead and correct me?
Arizona Peer and Family Coalition. Peers
Peer,
first.
Peer and family. See, I go alphabetically, and you use common sense and just to have it in front of you, so you probably have it memorized by now. Thank you so much for being here, Kathy. I hope you're doing well. Next, we've got Rachel Streif with Mad Moms. Rachel, how are you doing? I haven't seen you in person in a while.
Thank you. I'm doing great. And it's Rachel Strife.
Strife.
Yes, but I'm happy to be here, and I'm with the Arizona Mad Moms, and we're a group of caregivers that have loved ones with serious mental illness.
Well, I will be red in the face for a while now, Rachel. I grew up
That's
with a large family of friends in high school who were named Streif, and it was spelled the same in Sageville, Iowa. So if you ever get out to Sageville, Iowa, and by the way, there's not a whole lot to see there, you will have to correct them with the way they pronounce their name, okay?
Yeah, we do have Strife cousins here in town as well. So
All right. Well, thank you for being here tonight. Just so glad the Mad Moms and you're able to help us out here. Next, we've got Christine Savada, who is well known in the mental health awareness community. She's the executive director of NAMI Valley of the Sun. Christina, how are you doing?
I'm doing great. Good to be here.
Yeah, and I have to tell you, one of my biggest proponent, one of my biggest efforts is to actually ask people how they're doing. So when I ask you if you're not doing well, it's okay to say I'm not doing so well. Next, we're moving on to Lindsay Taylor. Lindsay is the clinical director of the Hope Institute. It's part of the Chandler Unified School District mental health system. And Lindsay, I understand that. Do you have a book coming out?
I do. I just launched it. Yeah, May 9th.
That's very exciting. So maybe we'll get to talk a little bit about that too. So what we want to do is we want to try to cover as much as we can. And I'm going to start out by asking you, Christina, and I know sometimes it's hard to, catch these things, off the spur of the moment, but what have been the biggest improvements in access to mental health that you've seen in the last 10 years here in Arizona and maybe even nationally?
Yeah, great question, Norm. A couple things. So one, really the growth and integration of peer support and family support services. Expansion of crisis services between our 24/7 statewide crisis lines to our mobile crisis teams to our crisis centers. I would also say increased emphasis on mental health education and early intervention, especially within our school settings. Reduce stigma. I think we see a lot of people doing work with campaigns, dialogues, mental health educational events, helping to reduce stigma. And last, I would say, is really stronger community partnerships. It seems as though more and more people are really seeing the need to work together and know that it's together, it is the best way for us to fill some of these gaps that we see within our system.
Yeah, I love that because partnerships are what I think COPA is all about. I just love being partners with each and every one of you. Rachel, as a parent and an advocate, speak to your journey while navigating the mental health system. I know when I'm working with people who have children in the DD or the ID system, developmental or intellectually delayed, who have children with autism, it's a tough thing to get through. Can you tell me a little bit about your journey getting through the mental health, navigating through the mental health system?
Sure. The first thing I can say is that a lot of the serious mental illnesses kind of come on without a whole lot of warning, and they are things that as parents, as caregivers, we're really not prepared for. I had no idea what serious mental illness was until I had to see it in a loved one and deal with it firsthand. The the other thing I didn't really know what a psychiatrist did until I needed one to save my kid's life. And I didn't know what psychosis was. I had read about serious mental illness in a college psychology course, but I had no idea what I was really in for. And I had to get educated, especially about something called anosognosia, which is a complicated word, but it refers to a lack of insight. And I had to become knowledgeable on medicine, on psychiatry, on the law, on how to help somebody that is not aware that they are sick. I didn't know the harms of marijuana, for example, marijuana-induced psychosis. I didn't know that people could kind of get sick out of nowhere with no warning. I was just unprepared. And so I had to become educated, and I had to learn how to advocate. I had to reach out for help, and I had to get help from experts and other moms and other families and other family groups to navigate the system.
Okay, just moving on with that just a little bit, Rachel. I just want to ask you something a little bit more focused. So, and this might sound like a silly question, but I'm serious. I mean, did you hop on Google? Did you type in mental health services or assistance in the Phoenix area or Arizona?
Yeah, I mean, I hopped on Google, but it was ultimately some friends who had walked this path before that walked me through it. And our group, the Arizona Mad Moms, have had the opportunity to do that for other people and pay that forward. It's not an easy system. I was told by a crisis officer about NAMI. Unless you know about serious mental illnesses, you don't know what you don't know. And I did. I took a family to family class that I found on Google. And that was the beginning of really becoming educated about the illness.
Yeah, I love that. And Josh, we're going to jump down to you. But the reason I love that so much, Rachel, is because one of the things Christina talked about was stigma. And I think stigma keeps people from talking about things. And I tell people all the time when it comes to certain issues, stigma being one of them, we're never going to erase it completely, but we can make it irrelevant. And, Josh, when we're talking about, working towards making things better for mental health in Arizona, what has been the focus of your efforts as an attorney advocating? I know that you've got a longtime relationship with Chick Arnold, who's somewhat of a well-known figure in Arizona.
Yeah, so I was fortunate enough to work with Chick side by side, office backed up to office for 8 years. And he retired a few years ago, so we've been separate for the last 3 or 4. But my efforts, I guess are focused on a few things. One is access to care on the SMI side, not the GMH side. The access to care on the GMH side is much different. When there's SMI, when there's anosognosia, we just have different barriers. And so access to care when it comes to hospitalizations, getting the appropriate length of stay, step downs, coordination of care, fighting for services that, in theory are in the law, an SMI member is entitled to, but they can't get. Housing, things like that, trying to get SMI access to care on the SMI side. Then I do a lot of education throughout the community, trying to let providers know, payers know what the law says in particular areas. So I'm constantly doing those kinds of things because we get lots of confusion that trickles down from the payers, from the regulators to the families who are trying to access services, who get told that their kid's not entitled to a particular service. So that education has to move upwards. A lot of implementation of the law, whether somebody's going through civil commitment or their parent has a guardianship, lack of understanding about those legal mechanisms and what they mean, the implications of them. And so that's a big part of it. Then new treatments within the system, trying to get those applied. I guess that's on the GMH side. I do a lot. I founded the Psychedelic Association of Arizona, and so there's a lot of mental health application on the GMH side, not necessarily the SMI side, and then in substance abuse applications. So those are some of the things that my practice does.
So Josh, and I know I'm jumping around here a little bit because some of these questions I actually had set up for later in this webinar, but let me ask you, I know sometimes some of these rights that you were working for and some of the changes that you're working for are hard fought. How often is something changed for the positive, then it slides back later and somehow it ends up not being available for people in the future, even though you thought that you'd secured the right?
It's a really good question because it just hits home on what we've been dealing with a lot constantly, Norm. We go out, and I'm talking about, when I say we on the legal side, it's ACME, the Association for the Chronically Mentally Ill, and then we've been lucky enough to partner with the Mad Moms on a lot of stuff. But we go out, we identify a problem, we draft legislation, we lobby that legislation, it gets through the legislature, it's signed by the governor. To do that on anything is very difficult. It's then put into the law, and 2 to 3 years later, it's either not available or we talked about it and then we backslide. So I don't know how much we want to get into it now, but our secure residential project was passed into law in 2019. It's still not built. COPA was the winner of the first bid in 2020 or 21. And so that's a very needed service. That's a vital service in the SMI continuum of care that we built in specifically for those who are really ill in the SMI system. Hasn't been built. So that constantly is happening. Then you implement a law or a change to a very big system, a $1 billion system. Trying to educate the leadership is difficult enough, but for it to trickle down all the way to the frontline workers where it needs to be implemented is really difficult. So it's a frustration and things that we're trying to work out, figure out how to better do that. But it's constantly a struggle.
That's a wonderful answer, and I have to tell you, I'm going to jump over to Lindsay for a second. But when you talk about housing and the things like that, all of a sudden it dawns on me all these external forces that really shouldn't have anything to do with the mental health system, but they do because everything's become more expensive. Zoning in some of these cities gets so difficult, but like you said, that might be a whole nother webinar. Lindsay, how are you doing today? Tell us about the Institute of Hope and your role.
Yeah, so I'm the clinical director over here at the Hope Institute, and the Hope Institute, this is the first of its kind suicide treatment center. So I like to say that we're a center bringing hope to individuals struggling with thoughts of suicide. The CEO, Dr. Derek Lee, he does a lot of research in the field, and he's actually been specializing in treating individuals struggling with suicidality since 2008. And he really saw a gap in the system where we were just, all we had available really was to put people in hospitals. And that's not always needed. Hospitalization, we know, is just stabilization. And then the actual treatment happens outside of that. And so Derek wanted to create a model that actually treats the suicidality. It doesn't just stabilize. It's not just interventions. It's an actual treatment model to try and get to the bottom, the root of the issue, treat the pathology of it. So we use a model called CAMS, and with that model, it stands for Collaborative Assessment and Management of Suicidality. It's a mouthful. But with that model, what we're doing is we're getting to what we call the drivers. That's what's leading the client to have thoughts of suicide, and then we're basing our entire treatment plan around that. Because we're just focused on treating the suicidality, we're short term. So we're outpatient care short term on average, clients in our program 6 to 8 weeks. And then we help families refer to ongoing counseling as needed to address any underlying issues, depression, anxiety, grief, family conflict, whatever that might be. So I want to draw attention again to like interventions versus treatment. So in a lot of systems and especially hospitals, it's intervention where they're trying to stop or modify a process. Safety planning is an intervention, and these are all needed. Crisis hotlines are interventions, but then the treatment is the actual healing of the diagnosis and relieving the pathology. So I compare it to medical model. Like if you had a broken arm, would you want just the Band-Aid and the Tylenol to help with the pain, or do you want the cast, right, to fix the broken arm? And so again, Derek's whole purpose to starting the Hope Institute was to actually really deal with the underlying issue, the broken arm, the healing of it. So that's what we do here at the Hope Institute.
That just sounds wonderful. And it's interesting because when we had a webinar last week, and it was about stopping the stigma. And we've talked a little bit about stigma today, but really when we hear about services like that are available, it's wonderful because anybody that's on the webinar today, or anybody that sees this in the future, will now know that is available. So I thank you so much. I'm going to jump up to my friend Kathy. Kathy, how are you doing?
Oh, I'm good listening to all this.
Kathy, so I never like to look at the negative things, but sometimes you have to point out the weaknesses to work on making them stronger. But what are the weaknesses in the mental health system, both here in Arizona, maybe more in the rural parts of Arizona, and then also nationally?
Well, I think Josh answered a lot of more on a specific level. So I'll go up to a bigger level. I call it in the clouds in a sense, but there is a lot of good stuff that happens. But again, it only lasts for so long and then we lose it. And this is a cycle that happens over and over. So there's a couple of things that I've identified. One is that access and the health department relies on the plans and the insurance companies to do their own oversight. It's like the fox guarding the hen house. The second is the RFP process. So I sat on an RFP team. I was one of 7 members that allocated the funds and the award. And what they wrote that they were going to do and what they actually ended up doing after negotiations was 2 different things. So that's the second thing. The third is policies are made at the national level and then filter down to the state level, and the policies are overwhelming. Their interpretation, they change, they're not updated, but they have a tendency to overwhelm at the provider level, and they tie their hands where they're doing more to adhere to policy than they are to treatment. And so that has to change. Another is the legislatures really don't understand our system. And I have been very disappointed. I sit on the governance of the committee at the Arizona State Hospital, and they are so critical of the hospital. And yet when they come out, the few that have, they change their mind. They see the goodness that the hospital does. So, but so many of them won't do it. They don't have the time, and the system is just so full of so many needs and so many changes. And I think, let's see, I think the last thing that I would like to share is the communication in the community, and the community on all levels really not working together. It's very segmented, and we're gonna, the Democrats, we're gonna keep all our people together, and it's we have tried to work very closely with the bad moms, and we've been successful, and that communication has helped both sides kind of understand each other's position.
Yeah, if you start talking about politics, I think I'm going to switch the conversation to religion. So let's just know that every time somebody talks about Republican or Democrat, I get a little bit shaky. But Kathy, just one other thing I want to ask you about with that. You have led in the Arizona Family and Peer and Family Coalition has led a mental health day at the Capitol for advocacy for quite a few years now, and it seems to be growing. I think we need to get more people involved, but how do you think that is having an effect on the legislators who maybe haven't been paying enough attention to what Josh and Rachel and others have been working towards?
We're right in their backyard and, less than 5 showed up. That was very nice of those that did, but they had an opportunity to walk out their door and come and sit and talk with us. And we had people ready to share, their stories, and that was videoed. So all those videos are going to the legislatures. But, I think we sent a strong message to the community and to legislatures that we're united, that treatment works. Not in all cases, but generally treatment works and people go on with their lives. And not only that, that if you walked among people at the day at the Capitol, you couldn't tell who was seriously mentally ill and who wasn't.
No, I thought it was
Just
an
like
inspiring
everyone
day.
else.
Yeah, I think it was just a fantastic job and that you did, and I think it was a very inspiring day. But I know Christina was part of that, and I actually saw Christina on TV talking about it too. But Christina, what advice would you give to an average citizen who is like Rachel was a while back and just started this mental health journey and searching for mental health services here in Arizona?
Yeah, I would say first to start local. I would say call your local NAMI affiliate or your local Mental Health America affiliate. Here in Arizona, you can call 211. We know our regional behavioral health authority can be very helpful in assisting someone. We have 988. 988's been an incredible resource for folks. That's available 24/7 for crisis support and referrals. And we hear from them again too, that you can call, even if you're not in crisis, you just need assistance, you need support, you need connection, you can give them a call. So we have that lifeline available. We definitely want to use it. We got Andy at COPA, who does an amazing job with callers coming in. For those private insurance, I would, recommend they call the number on their back of their insurance card. We have the SAMHSA's treatment locator, which is findtreatment.gov. We also have psychology.org to look for therapists. So there really are a number of different resources out there. And I would just, end and remind folks to be persistent. If you're probably not going to get the answer that you need right away, you're probably not going to find a therapist who's available tomorrow, but be persistent, keep at it, try these different resources. Eventually you will find someone who can assist and treat. And, we want to remind folks that they're not alone. And that's part of the reason why NAMI, for example, is here, is we want folks to know we're gonna jump in that dark hole with you and try to navigate your way out.
Yeah, I love that about persistence too, because I've got a friend in the autism world, and she's one of the most hard driving people I know, but she's been very successful. So I tell people you don't need to be that hard driving person, but latch on to somebody who is, and that's a great way to be persistent. And I love that. But Rachel, after, I don't want to say learning how to navigate the mental health system, because I think it's kind of like one of those things where you're constantly trying to learn more. But what advice would you give to a parent who is trying to find quality services? I think there's a lot of things out there, and believe it or not, I believe sometimes quality services for one person will not be quality services for another, because it's not a one size fits all situation. But what advice would you give?
Yeah. So I want to reiterate what Christina said about 988. The crisis hotlines that we have in Arizona are connected to our screening centers, connected to our law enforcement crisis training. And they, even if you don't think you're in a crisis right away, they can give you information, really helpful information. A time might come where you have to petition your loved one for an involuntary psychiatric evaluation. That's a really difficult, terrible situation to arrive at that requires a team effort. And so don't be afraid to call 988 for any reason at all, even just to ask questions and get information. The other thing that I try and explain to families is that we have a serious shortage of services in Arizona. Specifically, we don't have enough acute and long-term psychiatric hospital beds. And so it's hard to get that level of treatment. We have to learn how the system works and how to access those beds. And we have some very acutely ill individuals kind of being discharged home to mother. And we're, as moms, taking care of these individuals who probably should be in hospitals, to be honest. Untreated serious mental illness is not safe. I don't think we talk enough that individuals with certain conditions, especially if they involve combative or aggressive or delusional symptoms, if they are not treated, they can be very dangerous. And we have caregivers often placed in harm's way. And if we don't take these things seriously, people can get hurt. And if we don't learn to advocate and connect with other individuals and learn about the illness, taking a class, for example, on the LEAP method, I think every SMI caregiver that's been successful in engaging their loved one has had to learn the LEAP method from Dr. Javier Amador. It's a very slippery slope. It's very dangerous. It requires a low emotional temperature. It requires some strategy. It requires so much to be effective and to find those good services. I wish I could tell you one clinic or one doctor or one hospital that is the best. It's really, as far as SMI goes, you try and work with what you're given and then move on if you don't get what you need.
And you know, it's like this in so many different things too, but it's so important in mental health. I mean, when my wife first moved here, and she was looking for a primary care doctor, I said, well, I love my doctor. And she went and saw him and was like, you know, it's not going to work out. But and that's okay. And I think people have to understand that just because you have one situation that doesn't work out doesn't mean that you shouldn't just keep going. And you know, the difficult part is knowing where to start. Now, I know that Kathy or Christina or Lindsay or Rachel might have a different point of view on where to go, but I know, Josh, from your point of view with the experience that you've had, how would you advise somebody if they came to you and said, listen, I need some help? How would you advise them as far as reaching out and where to reach out to? And I know I'm asking a lot of the same types of questions, but every one of them is coming from a different point of view.
Yeah, and I'll give the lawyer answer to start, which is it depends. And when it comes to this this question, it really does depend what you're looking for. Let me just tag on to what Rachel said, just as kind of like a PSA. In our involuntary system, our involuntary commitment system, where you can have someone picked up, evaluated, and then potentially treated, what you're going to hear from a lot of people that are in and around crisis work, police, the crisis centers themselves, the crisis line, doctors, teachers, is that if the person's not actively danger to self or danger to others, they cannot be picked up and evaluated. In Arizona, that is not true. In Arizona, we have what's called a need for treatment standard, and it's called persistent and acute disability, which allows someone prior to that dangerousness to be picked up, evaluated, and then potentially treated on an involuntary basis. That's very important to know because lots of people are calling the emergency room, calling the police, calling the crisis line. And I've done this with the crisis line. I picked up and I've called for a half an hour, picking up different people. How do you petition someone in Arizona? How do you get them picked up on an involuntary hold? The answers are different, and very few people know about PAD. It's important to know you can get someone picked up prior to dangerousness. Okay, so circling back to your question, it depends on, I kind of divide the world into those who are into serious mental illness and GMH. If it's on the serious mental illness side, where we have a very robust system because of Arnold versus Sarn and our continuum of care, then I think we have very specific resources here that happen to be amazing. Go to other places throughout the country, we don't have these things. It's Andy Arnowitz and it's the Mad Moms. I'd be calling them on SMI issues. You can call me too at my law office. But as far as reaching out to community resources, if you want to know something in and around the system, Andy Arnowitz, Mad Moms are going to get you to the right answer. And even if they don't, they have the resources to connect you. Okay, you're in crisis, you need to understand what care you're entitled to, your family member needs to understand those kinds of things. So on that side, it's important. Then those are the resources. And Christina mentioned a couple others, Men's Health America, NAMI, but I think our spectacular ones are Andy Arnowitz and the Mad Moms. Okay, on the GMH side, you know, I think you have to be careful about calling generic providers who do not know the ins and the outs of a particular diagnosis. I would not be going to, if you looked up on Psychology Today, therapist for OCD, the same therapist that's going to pop up for OCD is also going to pop up for borderline personality disorder, is also going to pop up for some psychotic disorder. These are very specific, and you mentioned this, Norm, specific diagnoses that need somebody that has the experience to address those types of things. So I wouldn't be calling the generic line. I wouldn't be asking Psychology Today or Google for information about someone who needs to treat my OCD. I'd be looking for that specific service, or I'd be calling, you know, the Psychiatric Society and asking who has a good reputation on OCD or on borderline personality disorder. I'd be calling the Psychological Association, doing the same thing, trying to find somebody, digging a little deeper, spending some extra time, trying to find somebody who understands that world, who is a psychologist or a psychiatrist themselves, that can tap you into care that's going to be tailored to your disorder. Otherwise, you get pulled into this world that is unknowledgeable about your disorder, and it can be made worse. And that happens. I see that a lot in my practice. So it depends.
Yeah, I like that answer. My aunt, who was a psychiatrist, she passed away many years ago, but she used to say that, you know, people depend on providers depend often on their strengths and their specialty. And so if you go to the wrong person, it's not necessarily that they're trying to do you know, a bad job or to do any harm. It's just that's the specialty that they have. So I love that, especially the comparison when you talk about somebody with an obsessive compulsive disorder. So thank you for that. Kathy, we're talking all about all of this. And, you know, Josh has mentioned Arnold versus Arns a couple times. I happen to believe Arizona has a lot more services than a lot of other states that I've been aware of. But I know that outside the Phoenix area and maybe Flagstaff or Tucson, you hit sort of a services desert where things just aren't as available. Tell me about the state of the services outside Maricopa County.
Well, there's a couple of challenges there. First of all, the plans, they live in Maricopa. Their employees live in Maricopa or in Tucson. They don't live in our communities, in our rural areas. So they don't specifically know what's going on in those areas. And that is a real disservice. And I believe that they are mandated to live there, but that's not enforced. The second is the lack of prevalent data, because when the plans go out and look at to see what the barriers are, especially with autism, they find that everything's fine. Everyone's happy. It's the way they ask the questions and they use that. And so we have this phenomena where we have the Good Old Boys Club. So they keep services in-house. They don't refer out. Because they don't refer out, we don't have more providers. It doesn't show that there's a network deficiency. And the result is just a circular nightmare. And so it results in lots of fewer providers, and people have to go all the way to Phoenix. Another is, and I hear this in the discussion, we're all from an urban area. We make assumptions about the rural areas, and we extrapolate those assumptions and decisions, and those decisions don't fit. And so that becomes a nightmare in itself. Stigma is much worse in the rural area. I have survived my own little nightmare living up here. I just attached a gate to my compound so people can't get in. But it's a real different concept of mental illness and our dangerousness and how I'm respected and talked to. So it's been different. I moved up here about 5 years ago, and it's been very, very different culturally. The the second to last thing I have is the crisis system. Yes, it's very effective in the urban areas, but in the rural areas, we don't have all the resources. The length of time takes a lot, and they have a tendency with the old boys network to kind of work together and try to get around the system. And because there's no one here to really see what they're doing, they get away with it. And one of them was one of the plans, told the police department, you're to refer to us rather than the crisis system. And so, this happened for years until someone identified it. And then the last thing is NAMI. NAMI is not that evident in the rural area. I am president of one of the NAMIs. I could scream because it is so difficult. You look at what's happening in Maricopa County and all these groups and all these meetings, and yet we don't have that. So everything up here is frustrating.
Well,
Even the verbs.
yeah, I want to say two things. First of all, I'm glad that the second time you talked about the Good Old Boys Network, that you dropped the good part of it, because it doesn't seem like it's always good. So maybe it's just the Old Boys Network. But for those of you, the people that are watching or might be watching in the future, you've said up here several times, and I know where you live, but why don't you just tell everybody what part of the state you live in? You don't have to give an address or anything, because I don't want that gate bash down.
I'll tell you where I live, in the middle of the national forest, surrounded by the forest. I'm very, very isolated. So there's a couple of miles between me and the nearest neighbor. So I live in Yavapai County, where the sheriff's office rules the roost. There is a very close relationship between the sheriff's office and some of the providers. And so that's questionable as far as the data information that's shared. So it's very different.
Okay, well, thank you so much for that. One of the things I've always appreciated, whether you think it or not, is your honesty. But I want to jump back to Lindsay. So Lindsay, we talked earlier about your book. And I'm always excited to meet an author or to talk to an author, so to know the process they go through. But tell us about your book.
Yeah, so it definitely draws on my clinical experience, but more than anything, it's was sparked by my personal story. And so it's called The Rise of a Soul Soldier. I actually have it here. This is it. This is the book. It began really with the devastating loss of my 17-year-old son to fentanyl, and then expanded into something so much greater than me. It's part memoir, part guidebook, part tribute to those who we've lost, and then also those still fighting this battle. So I wrote it for anybody navigating suicidal thoughts, addiction, grief, and life's deepest struggles. It also speaks to those who stand beside someone struggling, so loved ones supporting someone struggling, and can offer guidance in that area. And then it also offers good insights for therapists and those who are in the profession. Because like I said, I draw on my personal and clinical, but really it is more of my personal story. So through my personal story, professional experience, and the voices of others who've overcome these battles. So I do share stories of people who've overcome it, because I think hope is one of the most essential things when we're talking about recovery and healing. And so really this book is just meant to bring light to the darkest corners of the world. It's not just about surviving. It's really about learning how to thrive and ultimately rise from the rubble, rise into our purpose, tapping into the miracle that we are. I talk about the odds of our existence in this book. And just truly remembering that every battlefield, because we all face battles, none of us get through this life unscathed. So just knowing that on every battlefield, there's a warrior waiting to rise. So it's really just empowering people in the healing journey. So it's broken into 4 parts, and definitely a guidebook to help people heal.
Yeah, I love that, and I love the odds of our existence.
Yeah.
I just think that's so cool. So a couple things. First of all, I want to get a copy of that for every one of the panelists today, and I was wondering if I can arrange for you to sign it, so that I can get it out to them. But for anybody else who is, watching the webinar today, or people that might watch in the future, how do they get their hands on this book?
Yeah, so it's on Amazon. So just type in The Rise of a Soul Soldier into the Amazon search bar, and it should pop up.
Wonderful. Well, thank you so much for doing that. It's not an easy thing to write a book, and I think from personal experience, not my personal, but writing it from a personal experience is always a little bit more difficult. So Christina, as someone who has had a profound impact on educating legislators here in Arizona, what do you believe is the most pressing issue right now that our legislators are going to need to address going forward with the system?
Yeah, I think there's a couple, but I'm going to focus on the one that I think is the most important, and that's workforce shortage. And that's across all behavior health care, from licensed counselors to psychiatrists to BHTs to peer support specialists. We need to be able to invest in workforce development, from training programs to loan forgiveness. You know, I'm hearing social workers are leaving the schools in droves to go to Starbucks and go to Amazon. I taught social work at ASU for a while, and my goal there was really to encourage folks to go out into the field and stay in the field, but many of them have not. And that's telling. So really looking at training programs, pipelines, loan forgiveness programs, competitive wages. They're not making anything, and they have some really crucial, important jobs. The other piece on that around workforce is really looking at the equity. We heard from Kathy and our shortages in our rural areas. And then not always just being able to provide that crisis response, but focus on that prevention and that early intervention piece. And the other thing I would say around workforce is really those specialty providers. And so we see folks with both mental health issues who also have intellectual developmental disabilities that sort of get stuck in a black hole. There's really no one that can provide that specialized support for them or their family that they so need and deserve.
And I love that when you talk about workforce. I think it's just so crucial. I'm passionate about the housing side of it. I know that everything needs to be paid attention to, but I think it's just so important because whether or not you have an emotional argument about something, I'm always able to look at also the cost of not doing something. And I know it's very expensive not to do some of the things that need to be done. So, thank you for that. I really appreciate you focusing on that, because we know so many people that do leave the field because they're not going to Starbucks to buy coffee. They're going to Starbucks to work, everybody. And they're not going to Amazon like my wife does to, have 100 packages delivered a day. They're going there to work. So I thank you so much for that, Christina. Kathy, as an advocate for mental health services and a prolific volunteer, and I was told to use the word prolific, how would you advise others who want to get involved in volunteering for some of these causes or some of these efforts that are out there right now?
Well, I think it's extremely important, especially with the budget cuts, and nationally, we as a country are going to have to cope with this, because this is going to fill that big gap of services and working together in the community. So, many of us that have been diagnosed, for me, it was, I read Viktor Frankl years ago and found a meaning in living. And that was doing volunteer work and helping others. And that is really what has kept me going. So each person has to find that special need. And I think, again, as our country goes through these changes, those people are going to start finding those needs and reaching out. And so I just hope they come to NAMI and Mad Moms. And I've referred many people to NAMI and many people to Mad Moms, and we each have something unique to offer. And it's not like we all offer the same thing. And so I think that they just have to find their way, and we have to provide that by doing trainings and reaching out and making ourselves available.
Yeah, I love it that you brought up Viktor Frankl, because I was reading him around the same time I was reading Leo Buscaglia, and I don't know if anybody knows about Leo Buscaglia, but he got me over my fear of hugging, because he's a hugger. But I think that's great, and we could tell everybody that's watching today, or everybody that is watching the recording of this in the future, to reach out to NAMI, to reach out to Mental Health America, to check out Mad Moms or read Lindsay's book. But
and the Arizona Parent Family Coalition.
And that's why you were the focus of that. Get involved, though. Get involved somehow, and there's lots of opportunities. So pay attention to everything that's going on out there. Follow all these groups on social media, and you will see an opportunity to take involved. So Josh, you have taken the baton, from Chick, Arnold, who is, like I said, a seminal figure here in Arizona mental health with the improvements. His name's actually part of the lawsuit that really made a difference. How are you building on the network that Chick built and that you were part of up until the time Chick retired?
Yeah. First, we're getting to know the other panelists for the first time. And Lindsay, I didn't know your story. I'm very sorry to hear about your son. But doing what you're doing and writing a book about it, I can't think of a better way to honor him. So anyway, I appreciate that. And I haven't met you, so just wanted to say that. When it comes to, building on Chick's legacy, he is a seminal figure. That lawsuit has his name on it and will always and forever have his name on it. That lawsuit built our system. I think we have a very robust SMI system because of it. And so trying to take steps in that direction in Chick's shadow is something that I'm always trying to do. I think, I'll focus on one thing, which is what ACME does, the Association for the Chronically Mentally Ill. And for the last 8 years, we've been pounding the pavement at the legislature. We've been, dreaming of solutions. We've been talking to the community at all different levels. We've been drafting the legislation. We've been lobbying it from start to finish. And so over the last 7 years, we've gotten 33 laws passed and signed by the governor, whether that was Ducey or now Hobbs. And so we've gone from reforming the PSRB at the state hospital and then eventually getting rid of it, to providing access to the state hospital in a different way, creating the Joint Legislative Psychiatric Review Council. So there's a standing committee at the legislature because of our work, creating annual reporting and oversight from the SMI system to the legislature, creating secure births in 2019, continuing to fight that fight until this year. We just got SB 1604 passed a week and a half ago. And so that's really, I think, the way that I've tried to pick up the torch or carry on Chick's legacy is through ACME and passing legislation and working on big things and small, trying to change the system when we hear complaints within it. Again, dreaming, drafting, and lobbying it through to the very end. So
Yeah, it's interesting, Josh. You say you're always going to be in Chick's shadow, and the truth is, in Arizona, a little shade is never a bad thing. But it's more like you are, widening the path that Chick led us through, and I just think it's fantastic that somebody is there. And I know it's not just you; there's many people, but that you're there, basically picking up the torch and doing the things that would make Chick proud. So I appreciate that. And it was interesting because I was going to ask you about ACME, but you mentioned that already. So that kind of takes me over to Rachel a little bit. Rachel, can you tell me, because I know ACME has had a lot of success, but so has Mad Moms, I think, with the legislature. Can you tell us a little bit about that? And by the way, when we're doing this, when we're talking about all the things that are being discussed today, it is a call to action too. So everybody that sees this, you can get involved. For Rachel.
Yeah, sure. So one of the things that is a downstream effect of Norm, this housing shortage, and Christina, the workforce shortage, and also the shortage of beds, is that our loved ones with SMI are ending up behind bars. They're not getting treatment and they're ending up in the criminal justice system. And that is where, unfortunately, a lot of our SMI caregivers that's the space that many are in. And we've had some real tragedies, caregiver assaults, and even caregiver homicides. We're not going to sugarcoat it. And we've just gotten together as mothers, as caregivers, to identify where are those gaps in statute. We've taken time to learn Arizona statute. For example, discharging from jail is a high risk period. So we have tackled drafting legislation to help change some of those gaps. And what has worked for us to help get our bills through and to help support ACME with their bills is when moms show up and tell their story. And when the legislature can hear what is happening, for these families and they hear the same story over and over, that's really been a call to them to advance this legislation and for our governor to sign it. I refer to us as a ragtag band of mothers in t-shirts. And that's really what's been moving the needle and our 3-minute stories. And we just have to keep sharing.
Well, thank you for your truth and passion, because I think those are the things that really drive change. But Lindsay, I want to jump back to you. 2 things. First of all, I'm going to ask Lindsay a specific question, and then I want to give her just a minute to give us any final thoughts, and then I'm going to run through the entire panel with final thoughts, because we've got, let's see, 5-6 minutes left. But Lindsay, can you tell me how, and this is a difficult thing, I know, but how do we reach people before a tragedy occurs? I think it's one thing to feel bad. I'm, personal story I told last week with the webinar that we had about stopping the stigma, but I had an uncle, he's passed away now, but he had 18 children in Iowa. He lived in sort of a rural community, and in the early 70s, one of them completed suicide. And it was such a tragic thing, but they never dealt with it. And over the next 15 years, 3 others also took their life. And I always felt bad about that. But how do you suggest people reach out to try to prevent things before it gets to that horrible situation, even one like you had to deal with?
This question is a big one. And I think that I wish there was an easy answer. We wouldn't have these problems, right? But I'm going to answer it like this. I think first and foremost, healing happens in connection. And so to truly reach like the most vulnerable before tragedy occurs, we have to go beyond just services, and services are very important. So not underestimating that at all, but we must help people deepen their connection with themselves and with others. I always say the root cause of addiction is a lack of connection. I would say the same is true for suicidality and any of those other deep struggles. So I think we need spaces for connection, support groups, mentorship. Mentoring programs are great for that. I think we've been talking about stories. Stories can be really healing, just knowing that you're not alone in that struggle. We say that all the time, you're not alone, right? We say that because it's really important. People need that connection, human to human. So early intervention, of course, I think is huge. So prevention efforts at, mental health education starting at a young age, I think is a big piece of this. We need to address all of this before it even gets right to the spot where it's a crisis and then unfortunately potentially a tragedy. Beyond that, we've spent way too long, I think, applying Band-Aids to deep wounds that without ever touching the pain beneath it, right? And so shifting, I also think, from crisis support again is huge and we need it, but we also need true like soul restoration, like healing on a soul level. So I know I'm going deep with this, but like truly, if we're really talking about what we need and at the root of this, spaces where people can share their truth without shame. So again, I think that connection piece is huge. And then I want to say we cannot forget the roles of parents. So helping parents do their own healing will then help their children thrive, which then creates healthier communities. And when families are supported, our entire communities grow stronger. And so we need to change generational cycles, right? Generational patterns. And I'm not blaming parents again in struggles. I'm just saying, like, even as a parent myself, I had to confront my own stuff, do my own healing to become better for my kids. Again, strengthening those communities. So I think the answer to this is not easy. There's many layers. Services are absolutely important. But really connection, I think we really need to dive into that connection piece. We live in a very connected with technology world, yet we're so disconnected at the same time because we're just mindlessly scrolling,
Yeah, I did a paper in graduate school about Jane Addams and her global community. And that's what we have now, but it's also one of the most isolating things that happen, technology.
Yeah.
So, but thank you so much. I got goosebumps there, Lindsay. I'm just going to tell you that. But so give me 30 seconds. The last message you'd like to give to everybody that's watching.
First of all, I just want to say this panel is amazing. Listening to everybody talk, Josh, thank you so much for what you said. I think really this issue is going to take a cultural shift, truly, like a true shift in our culture. Again, valuing the connection over correction, presence over performance, right? Like we need people to be present, not so much worrying about how they're performing or their achievements, right? Those are great, but like presence is huge. And then healing over hiding. So instead of staying silent, not talking about it, we need to be talking about these things. We need to be healing, which we've been saying, right? Breaking that stigma. So that would be my thing.
I got to get that book. I'm telling everybody else in the room, I got to get that book. Rachel, give us your final thoughts.
Yeah. On the SMI side of things, we really need to step back and look at the matter of parity. You know, SMI conditions are brain illnesses and they hit, you know, around the age 20, give or take a few years. Autism hits around 2 years old. Parkinson's hits around 40, Alzheimer's hits around 60. Somehow there's profound discrimination against this group of individuals who develop these very debilitating conditions right at around the age of 20. Parents aren't prepared for that. We didn't plan for this. And now we have a, you know, potential disability and a potential person that we're going to have to advocate for and be there for forever. And we need to hit policy hard in terms of discrimination. This group is terribly discriminated against. We don't get caregiver pay in Arizona for SMI like they do for developmental disabilities. We don't have housing entitlements for SMI like we do for developmental disabilities. There's 6,000 people on the SMI housing wait list for supported housing. We have federal laws like the IMD exclusion and the inmate exclusion that are huge barriers to treatment for the most seriously mentally ill. Until we start really focusing high level on what real discrimination looks like, you know, we've got to be loud and we have to lend our voice to that. And then we'll see some real change.
Yeah, listening to you and Lindsay and Christina and Josh and Kathy, it's almost like it's a war being fought on so many fronts, and all those fronts are important. And you know, Kathy, final words on what you heard tonight and what you'd like to have everybody take away.
Yes, just one thing that I keep thinking of. There's unintended consequences to all the decisions we make, and we have seen this time after time after time. So we have to be very careful. And one thing that Chick Arnold did, and that was go to the community and find out what community members, peer and family members, what they wanted. And I think that's very important to try and leave that segment out in any decision making. Will not result in us moving the system forward.
Well, thank you so much, Kathy. I think that's exactly right. They're telling people what to do without really knowing why things need to be done. Josh, final words?
Yeah, if we're talking about navigating mental health systems, again, I think we have to divide the SMI world and the GMH world. On the SMI side, I think I'd echo Rachel's comments. Get care as soon as you can. And if you need advice, you need understanding of how to access that care, call Andy Arnowitz, call Mad Moms, call me. On the GMH side, please get specialized care. It's out there. It takes a little bit more time to access, but you can do it. And then when we're talking about kids, I'd be careful about reaching out too soon when you see mental health conditions. If you want more information on that, give me a call. But on SMI side, care as soon as possible. On GMH side, it's specialized care. On the kids side, be careful about reaching out too soon. That would be my words.
Perfect. Thank you, Josh. I have to tell you, if there's anybody that's not on this panel who's sort of the hero tonight, it seems to be Andy Arnowitz. So I talked to Andy right before this panel today, and I'm so glad that his name is being thrown out there so much. So we will get more people calling him. Christina, I wanted to, end with you because I know that you are involved in so many things. Final thoughts on navigating the mental health system here in Arizona.
I would add, just remain persistent and don't stop calling and asking until you find some hope. And to add to Lindsay's little list, one thing that we use in our NAMI courses is skills, not just pills. We might take pills, but we need the skills to survive and manage this process.
Yeah, I gotta tell you, listening to you and Lindsay, I have to go into the t-shirt business because we have to have those sayings on people's t-shirts everywhere. So, but thank you all for being part of this. Thank you, everybody who joined us today. I want to remind everybody that we do have 2 more webinars that are coming up next Wednesday and the following Wednesday. Next Wednesday, I'll actually be moderating the webinar from Wichita, Kansas. I'm going to be driving to Iowa, but I'm making a special stop to be part of that. Go to copahealth.org/resources if you want to register for those or find out other services. And also, most of, if not all, most of the people that are on today were part of our public service announcements system. So we've got the PSAs out there. And if you need their information and you're not able to find it, reach out to me, reach out to Andy Arnowitz, and we will make sure that you are connected with the panelists that we have today. Until then, until next week, everybody, thank you so much. And let's give a big round of virtual applause for all of our panelists, because these are people that I'm glad to know, and I'm just so happy that they are part of the solution, or what potentially is going to be the solution. Thank you all.
Thank you.
Thank you, Norm.
Thank you.